Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted to welcome a very accomplished officer from the Indian Army turned entrepreneur, Colonel Hemraj Parmar from India. Colonel Parmar, welcome to the show.
Thank you so much, Ashutosh. It's a pleasure indeed.
Thank you. Colonel Parmar is the co-founder of DoctCo, and we'll talk about his company. So before I start talking about your company, tell me a little bit about your own journey in brief.
Thank you so much, Ashutosh, for inviting me to this wonderful show. So I was in the Army for 23 and a half years and took voluntary retirement in 2012. Thereafter, I went to IIM Ahmedabad for my regular MBA. And while in the Army, I was looking after the healthcare needs of the veterans, as part of which I had 38 clinics under me, spread over 6 states. I was also instrumental in adding 22 more new clinics, taking the total to 60. And this was something which was in the initial stages, and I was part of that formative team. This initiative and experience also aroused my interest in the healthcare industry. Thereafter, I've grown through the ranks and have held various leadership assignments in diverse healthcare companies within and outside India.
Wonderful. So let's now talk about DoctCo. Tell me a little bit about this venture and what was your motivation to start it?
Sure. So the three pillars of healthcare industry are quality, affordability, and accessibility. We make healthcare accessible through our super specialty telemedicine centers, as part of which in DoctCo, we are trying to bridge the super specialty divide or the super specialty gap in tier 2, 3 cities and rural parts of India. So we provide high quality and affordable healthcare services within 15 minutes of walking distance from people's residence. As part of this initiative, we open state-of-the-art telemedicine clinics and connect people with a super specialist in top-tier hospitals across the country for super specialty consultations, and thereafter provide seamless support through a marquee DoctCo Sathi, who acts as a family member away from home. We have launched two excellent products, reimbursement of bills and interest-free EMI to the needy patients to address their affordability issues.
Interesting. So, Hemraj, the whole topic of telemedicine has been there for the last 30 odd years. And I remember when I was working with Hughes, there used to be big VSATs that used to be used.
Sure.
And it was a very expensive solution. Tell me a little bit about how telemedicine has evolved and what kind of devices and tools are you using for communication?
Absolutely. So in a face-to-face consultation, Ashutosh, a patient needs to visit a doctor for consultation.
Correct.
This is costly and time-consuming, especially for poor patients staying in smaller towns of India. For super specialty consultations and treatment, the situation is even more grim because of lack of availability of super specialists and the required, hospital healthcare infrastructure. To bridge this gap, we decided to take help of the cutting edge technology, which we are currently exploiting in DoctCo. As part of this initiative, we set up a telemedicine center that has a state-of-the-art telemedicine suite. We have Wi-Fi enabled Internet of Medical Thing devices and thousands of super specialists of all super specialties as part of our portal who can be reached out at the click of a button. In the center itself, we have a junior doctor and a nurse. So when a patient walks into our center, he or she is screened through these IoT devices. Her clinical parameters are taken. Along with the previous history of the patient, this clinical information is uploaded on our cloud-based EMR system by our clinician and the other DoctCo center team on a cloud-based, very HIPAA-compliant, secure system. Simultaneously, we also book the appointment of this patient with the available super specialists from our vast pool of these 4,000 plus super specialists spread across the country, in the various hospital chains.
Right.
So at the appointed time, usually, this happens within 15 to 20 minutes of the patient walking into our center. The super specialist joins this video consultation call and consults the patient.
Okay.
During this consultation, the patient is assisted by this junior doctor and the paramedic who's present in this center. And this junior doctor really acts as a bridge between the doctor and the patient. So sometimes, the super specialist is not able to understand the local dialect, or the patient is not able to understand the clinical terms. So this junior doctor acts as a facilitator. So this entire consultation, teleconsultation, it quite closely mimics in-person consultation, obviating the need for this patient to really travel to a bigger city, which is very expensive. Typically, if a city is where we are currently present, 100 to 150 kilometers from Delhi NCR, for example, patient usually travels with the family. So a lot of commute, other logistical expenses. So it can set back a family by 5 to 10,000 rupees.
Easily.
While sitting in a center, within 15 to 20 minutes, the patient, after arrival in the center, can be consulted by the super specialist of choice. And the patient need to travel to bigger cities only in case the doctor recommends either more super specialized diagnostic tests, or a medical procedure, or a surgery, or an organ transplant, as per the requirement.
Fascinating. And what are some of the more common types of medical issues that are most suitable for a teleconsult?
So basically, teleconsultation caters to all types of consultations. Most of the consultations which are happening currently in India are GP consultations, with an MBBS doctor.
Yeah.
And the super specialist consultations are limited currently because of the non-availability of the super specialists. And that's where DoctCo comes in. We have partnered with some of the top tier super specialists across the different super specialties in the country. And through this initiative, patient is able to make an informed choice about the super specialist or the hospital for consultations and further medical treatment. So as told, this drastically reduces his commute time, his expenses, thereby increasing the productivity. The government of India is also partaking of this initiative and has launched some of the e-clinics, for example, in the UP state. And with the PPP, this is likely to increase further across the country. But one of the major challenges is, the kind of expenses which the providers need to incur. Currently, it is not very, affordable, but definitely with the right intervention support, financial support, the government of India can really make it very, very viable for the people staying in tier 2 to 3 cities and rural parts of India.
Well said. And tell me, Colonel, the COVID-19 pandemic seems to have given an impetus to teleconsultation. Is this something which is factually correct? And do you see this continuing in the long run?
So absolutely, Ashutosh, COVID wave proved to be an inflection point for the entire gamut of remote healthcare delivery, because of the fear of spread of infection.
Correct.
You have seen we've had a tremendous shortfall of doctors, beds, essential medicines, and the, support, infrastructure, and ecosystem to look after the infected patients. Telemedicine had found a new kind of acceptance among all the key stakeholders in the value chain, including doctors, patients, healthcare organizations, and everybody else. So during the pandemic, when we had this first wave, second wave, the teleconsultation saw a rapid increase, 6 to 800% in the country.
Correct.
But once the situation stabilized, as the COVID infections dropped, there was also a consequential drop in the teleconsultations. But telemedicine has found a strong footing and definitely here to stay. Just to tell you, globally, it was almost a $80 billion industry in 2020.
Wow.
And this is likely to increase to $400 billion by 2027, growing with a CAGR of almost 26%, in this period.
Incredible.
And the Indian telemedicine market was almost $1 billion plus in 2022, and it is likely to increase to almost $5 billion plus by 2030, growing at a CAGR of almost 21%. There are some key players in this, but we need definitely more people, because the government of India is promoting wellness and primary healthcare, wherein currently across the country, screening of the patients is extremely low. The preventive medicine needs to be given the required boost. The government of India came up with that initiative of 150,000 wellness centers across the country, out of which 86,000 have already been started, and many more yet to go. So this, combined with telemedicine across the country with PPP, right, funding, government pitching in for deficit financing for these kind of initiatives to the providers who can provide these high quality services, can really disrupt the market in the coming years.
Fantastic. Great response. Thank you. My next question is that, while there are a lot of advantages of telemedicine and the ease of being able to, for a patient to be able to communicate and consult with a doctor or specialist far away, what are some of the challenges that you have faced while being able to roll out this incredible service?
So one of the challenges, Ashutosh, has been the acceptance initially, in the rural areas, because most of the patients who are staying there are patronizing some of the GPs who have been operating there for decades. So their loyalty is really something which is very difficult to break, and a lot of stranglehold of these doctors on these patients in that ecosystem. They will not send a patient to a super specialist for higher end treatment unless the situation becomes grave or out of control. Then also, when you want to launch these kind of services at scale, this is going to be a very expensive proposition. And most of the healthcare, if you see the primary healthcare delivery across the country, the involvement of the major players or the major hospital chains or the providers is absolutely minimal. So it's only the government of India which is spending, and in trickle, some of the healthcare new age medtech and health tech companies are really investing into this initiative. So at scale, to break even is very, very challenging, but this is definitely a service which is required. This bridges the super specialty gap for small towns of India, home to almost 67 to 68% of the Indian population, which is still bereft of super specialty care. So provided we surmount these financial, regulatory, and other operational challenges, we can bridge the super specialty gap in the smaller towns of India.
Very interesting. My next question is that, there is also a lot of talk about the matter of patient database privacy and security. Given the vast networks of telemedicine, how does DoctCo manage to ensure that patient privacy and security of information is kept safe?
Sure. So, this is a very, very important aspect of, healthcare delivery. Patient safety and confidentiality of clinical information is very, very important to us.
Correct.
In 2020, the government of India issued detailed guidelines on telemedicine. But this is also, an area which is highly unregulated, in the country. So, in the wake of COVID-19, the digital healthcare has gained, proliferation of interest and global investment, in the US, European markets, and also some of the developing economies. The WHO has published guidelines and recommendations for these countries to successfully implement, telemedicine at scale across the nations. And this is something which we need to look into. The US has HIPAA compliance. All the healthcare providers, including telemedicine companies, are supposed to follow these. In India, this market is still highly unregulated. We do not have still very comprehensive instructions on patient safety, confidentiality. So what we need is, Ashutosh, a seamless system, wherein there is interoperability.
Correct.
So let's say on our portal, we have a patient, we have something known as Abha cards now, Ayushman Bharat health account cards, right? So every patient across the country through this will have a unique hospital ID, UHID, as we call in the hospital ecosystem. Abha cards will be issued to everybody across the country. So wherever the patient is, this clinical data would be uploaded on a cloud-based system. So across the various health systems, whether it's a hospital or a diagnostic chain or a pathological laboratory or a telemedicine center, in case a clinician, I mean, the people who are authorized through a various, layered system, they will be able to access this patient data, the past history of the patient, the correct state of the clinical state of the patient, so that based on the history of that patient, right kind of diagnosis and followed by the treatment can be provided. So the seamlessness and the interoperability across the various health system is something which is required. This needs to be closely regulated, monitored, so that there is no loss of information or the clinical data. And in India, we are still nowhere close to that mandate. This definitely needs to be worked more comprehensive by the healthcare regulatory authorities in India. And I'm sure the government of India, the Niti Aayog, the National Health Authority, they are currently working on this ecosystem.
Wonderful. And what do you think is the technological infrastructure that needs to be, created or supplemented in order for telemedicine to be a big success?
So Ashutosh, telemedicine is based on very inexpensive technology. There is proliferation or democratization of the telemedicine solutions. They are available very cheap. As soon as the patient enters the teleconsultation center, the screening is carried out through the IoT devices. Thereafter, this data is uploaded to the consulting super specialist on a secure cloud-based network. The super specialist has access to all the relevant patient data, clinical data, along with the past history before the this doctor comes for consultation with the patient. So it's not just the current data, clinical data, which is available to him. He has access to this history. And this super specialist doctor is typically available on a screen. Like we have this face-to-face consultation. There's a doctor, a junior doctor sitting in the telemedicine center, and across the table is this patient along with his or her attendant. Junior doctor is available during the entire consultation process to guide the patient and facilitate the consulting, super specialist. And as per the requirement, this clinical data can be seen by the super specialist through the IoT devices in a real time frame also. Right? You want to see the ECG or, through otoscope or, ophthalmoscope, the, eye that super specialist sitting thousands of kilometers away can actually see, like you do in a face-to-face consultation. So this very closely mimics the face-to-face consultation, and this can be a boon to remote areas, hilly areas currently where the healthcare delivery is suboptimal.
Correct. Well said. And what do you think are the legal or regulatory challenges associated with telemedicine?
So, like I said, currently this market is not really well regulated. It needs to be regulated. The government of India needs to come up with detailed guidelines. The telemedicine guidelines which were issued in 2020 are not really very comprehensive. So the responsibilities need to be fixed at various levels, at the level of the government, healthcare ministry, at the district level, state level, then the private operators, certain quality frameworks need to be put into place, the KPIs which can be monitored so that you are able to extend only high quality of services. Patient safety and confidentiality has to be kept in mind. There is no loss of clinical data which can adversely impact a patient. In the Western countries and European markets, they are extremely cautious of the patient related information.
Correct.
You can literally sue the healthcare provider in case there is loss of data. So something of similar standard needs to be provided in the country. The patient's interests need to be secured while extending high quality of services.
Well said. Well said. So I have time for two more questions for you. My next question is that how are insurance companies handling the reimbursements that are, to be taken or be given for telemedicine consultations?
So, Ashutosh, this is really an evolving market because there are very limited players. The insurance companies typically do not provide, facility for OPDs or teleconsultations, online consultations in their healthcare insurance covers. So, except for in very exceptional cases, and it is very expensive. So, only some of the very, very expensive healthcare policies would have this as one of their provisions. This needs to be democratized. I think the government of India needs to consider it, given that there are large number of people living in rural areas who do not have access to a super specialist. So up to secondary care is available in some tier 2-3 cities. Even tertiary care is available these days. But the teleconsultation is something which every person should be able to have access to. But the current guidelines are not really in the favor of a patient. It needs to be made more viable, accessible, and more affordable to these patients for it to scale up to the level that is expected in a country which is the most populous country in the world. We've taken over China recently.
Absolutely.
So a lot more needs to be done on this. But yes, I think the government of India, Niti Aayog, National Health Authority, they are all working on this.
Well said. And my last question to you, Colonel, and this is for the thousands of people who will listen to our conversation. Based on your own amazing journey from the army to IIM Ahmedabad to becoming an entrepreneur in the health sector, what would you say are 3 lessons you would want our viewers and listeners to take away from your journey and from our conversation?
So I think, for me personally, the 3 major milestones in my career were joining the army. I was very passionate, about this. I at one point in time also, considered becoming a doctor. So frankly, by joining the healthcare industry, I've been able to achieve both the aims.
Absolutely.
And when I wanted to have this transition from the army to the corporate world, obviously I wanted to have the best education which would help me transition smoothly. So I went to IIM Ahmedabad and ESCP Europe in Paris, which served as a fantastic bridge between the army and the corporate healthcare industry life. Then at some stage I felt that I had enough wisdom and experience to start something of my own. So my partner Nimit Agarwal and I met and discussed this initiative DoctCo, which we launched about 2 years back, and it's a fledgling startup. Currently we are expanding. We are present in 15 cities and scaling up to 30 cities across the country. There are certain values which I believe in, Ashutosh, which are integrity and commitment. So if you do not have integrity, obviously everything else becomes absolutely redundant.
Correct. Wonderful. And on that note, thank you so much for speaking to me about your amazing journey. Thank you for talking to me about telemedicine and DoctCo. I think I learned many, many new things about telemedicine from you today. Thank you for taking us through so many different aspects of what are some of the positives, and thank you also for highlighting some of the areas where a lot of improvement needs to be done by different stakeholders, including the government. Thank you for speaking to me, and good luck to you.
Thank you so much, Ashutosh. It's been a pleasure speaking with you.
Thank you. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.